The treatment of the Parkinson disease. There are different groups of drugs that are used for the treatment of Parkinson disease. Number one, anticholinergics, for example, benztropine, orphanedrine, and procyclidine. But the side effects with these anticholinergics are dryness, constipation, urinary retention, blurred vision, glaucoma, dysrhythmias, and hallucination. The second drug used is amantadine, can be used alone or in combination of the anticholinergic. The amantadine increases the endogenous production of dopamine. The third drug is L-Dopa. The L-Dopa is the precursor of dopamine, and 10 to 15% of this crosses the blood-brain barrier. L-Dopa particularly relieves bradykinesia. There is a peripheral conversion of L-Dopa to dopamine because of the enzyme dopa decarboxylase, and this enzyme is present in the GI mucosa, and when the drug is taken orally, the dopa decarboxylase converts L-Dopa to dopamine, thereby decreasing its effects in the CNS. That is why L-Dopa is given with carbidopa. The carbidopa is a drug which inhibits dopa decarboxylase. The advent of L-Dopa decreased the need of surgery in the Parkinson disease. What is the ratio of L-Dopa to carbidopa in the tablets? The ratio is either 4:1 or 10:1, dopa to carbidopa, and it comes in a tablet as 100 milligram of L-Dopa and 25 mg carbidopa in a tablet, or 100 mg to 10 mg, or 250 mg to 25 mg of L-Dopa to carbidopa. So the early administration of L-Dopa in the disease delays the late complication of the disease. This is the advantage of early administration of L-Dopa. The side effects of L-Dopa are postural hypertension, dysrhythmias, and akathisia or restlessness. Number 4, the next group of drug is the addition of salicyline or the MAO inhibitor class B that decreases the metabolic breakdown of L-Dopa, thereby increasing its effects. Salicyline or MAO inhibitors B decrease the oxidative damage to the neurons and thus slow the disease process. But the disadvantage is that salicyline has got acute toxic reaction if used with meperidine, SSRI, or tricyclic antidepressant. Salicyline is metabolized in the body to amphetamine. This is important. Salicyline is metabolized to amphetamine. That is why when people use salicyline, they get insomnia and anxiety. The disadvantage of salicyline is that there is an increased mortality with the use of salicyline. The next group of drug is COMT inhibitors, catechol-amine O methyltransferase inhibitors. They decrease the fluctuations in oral absorption of the L-Dopa. So if there are fluctuation after oral absorption, COMT inhibitors are added to the regime. The dopamine agonist. They are also used in Parkinson disease. There are two groups of dopamine receptors. Actually, there are 5 different types of dopamine receptors, but they are grouped into 2, D1 and D2. And the drug efficacy of these dopamine agonists depends on the type on which the receptor, on the type of receptors on which these drugs act. The first group is ergot derivatives, bromocriptine and pergolene. Bromocriptine acts on the D2 receptor, whereas pergolene acts on D1 and D2 receptor. But the side effects of these drugs, because they are ergot derivatives, are hallucination and delusion, vasospasm, pulmonary and retroperitoneal fibrosis, erythromyalgia. The contraindications to the ergot derivatives, bromocriptine and pergolene, are psychotic disorders. So they should be contraindicated in psychotic disorders, and they are avoided in the people who had a recent myocardial infarction and have a peripheral vascular disease and a peptic ulcer disease. The other drugs, the non-ergot drugs, are pramipexole and ropinirole. Their side effects are sleep disturbances, and uncontrolled somnolence requires their withdrawal. The COMT inhibitors, talcopone and entacapone, they inhibit the peripheral conversion of L-DOPA to methyl-DOPA. Remember that the other drug, carbidopa, prevents the conversion of L-DOPA to dopamine, but COMT inhibitors prevents the conversion of L-DOPA to methyl-DOPA. But the side effect with these drugs, because they are antihypertensive, they cause postural hypotension, and also they cause discolored urine, and there may be an abnormal LFT. In these patients, LFT is done every 2 weeks for the first year of treatment. The other drug which are to be used is glutamate antagonists, may also be beneficial in Parkinson disease. The surgery in Parkinson disease. Number 1, high frequency stimulation with electrodes in thalamus and globus pallidus is effective in relieving tremors in advanced disease. Number 2, transplantation of fetal midbrain negral dopaminergic cells in the putamen are also effective. Number 3, transplantation of adrenal medulla is also effective. The old surgical procedures of post-ventral pallidotomy or thalamotomy is 90% beneficial in curing the tremors, rigidity and bradykinesia on the opposite side of the body if done unilaterally, but has the side effects of cerebral infarction and hemorrhage, dysarthria and cognitive disturbances.